as a result of your transplants?
Oh, sure.
And how does that drive you in terms of developing healthcare technology? Is that okay?
If you have an hour.
I have time. You're the one who's busy.
Patrick, I'll just have you go ahead.
Yeah, you did. Okay.
Patrick, I'll just have you go ahead and introduce him too, and just we'll cut right to it, if that's cool. Great. Right. Good afternoon. We are here once again with Harris Corporation. I have Patrick Howard with us once again, and we also have Jim Traficant, VP of Healthcare Solutions for Harris.
Jim, thank you for joining me for this one question. And I know that this is personal for you, and I know healthcare technology is personal for you as a two-time liver transplant. So, can you tell me, how does that drive your decision-making and your strategic planning of the healthcare division?
That's pretty simple. We are on a mission.
You are on a mission.
Yes. What I discovered as a patient was that healthcare has lots of data. What they lack is information. In every market that Harris serves, we deliver information to decision makers with security so that they can make better decisions with lives at stake. We do it at the edge of the network in national security. We do it for defense. We do it with 2 million passengers riding on the Harris network every day in the FAA. And in healthcare, it's lacking, and that's what Harris is bringing. We're bringing situational awareness, getting the right information to the right person, on the right device, at the point of care. And when I was going through my transplants, I had wonderful care. People were passionate about trying to save my life. What they lacked was the information that would allow them to do it safely, securely, and at the point of care. And I could give you multiple examples. And let me share one. One of them was, after my first transplant, my neighbor saved my life. We were the 5th to have the surgery, the first that weren't related. He had 3 children, lived across the street from me, and volunteered to risk his life for me. I had a very quick recovery, and Frank was struggling. And the doctor said, they said, the surgery is science, medication is art. I came out of the surgery, and I had a very quick recovery, waiting for Frank to get well. I went into rejection, and they couldn't stop it. And they said, we're going to give you a shot. We don't know if you cure you or kill you. We'll know in 20 minutes. I took that shot for a month. When I finally got out, I was home a couple of weeks, and it happened again. I went back in. I was the first person to take the medication, actually created to save my life. When I got out the second time, I started to study my blood work and my medications. And I could see, I came up with an algorithm that could predict when rejection would occur. We were able to take the art of the medication and turn it into science using better information. I developed the symptoms a 3rd time, showed it to my doctors. We changed the medication based on the data, and we were able to avoid the rejection episode and hospitalization. It saved money, saved high-risk treatment, and saved my life. Better information can transform healthcare, and Harris is on a mission to bring better information to healthcare.
Wow. Well, as a Floridian, I love the passion that I'm hearing. I know Harris is going to do a great job in developing this HIE.
Yes,
I'll be one of those that will opt in for it, and so I know that it's going to happen. But you know, Jim, it's great that you were able to do that. You're an intelligent guy, educated, and you probably know a little bit about healthcare. How about those that are less fortunate in the rural areas, in the minority community, that don't have that intelligence level? The physicians don't have access to the EHR technologies that, and some of them don't even have broadband to connect to an HIE. How do we solve that? How do we solve that issue?
No, we must solve that issue.
Absolutely.
There's a great book written by the CEO of Kaiser Permanente called Healthcare Won't Reform Itself. And he says, you want to transform healthcare, you need a connected framework. It's what Harris does in every other market. Anywhere in the world to deliver information on any device authorized to see it. We could do that in the United States.
Absolutely. Yeah. Take your enterprise framework, let's make it commercial.
Let's make it. In fact, that's why we bought CareFX yesterday.
Yes, I was going to ask you about CareFX. Absolutely. And good acquisition for you.
It was excellent. They're a great company.
Great company, aggregate data very well across HIEs. Tell me about it.
What they do is, what Harris has been strong, we provide information at the federal level. When we talk about HIEs, sustainability is always the issue. How do we keep it going? Well, the government government recognized if we're going to create a tipping point in health information exchange, we've got to get the federal agencies involved. And they turned to Harris to make it happen. We connected 7 federal agencies, the largest creators of health information, like Military Health, Veterans Affairs, Indian Health Services. They don't have common electronic health records, but they need to share information. We made it possible. But beyond that, the largest consumers of health information need access, like the CDC, National Cancer Institute, Social Security. Social Security spends $500 million a year trying to find health records so they can do benefits determination. They testified that it takes on average 83 days. You make a request for benefits, 83 days to get the information so they can figure out what you're supposed to get. When they went through the Connect software that Harris created, 24 seconds. 83 days to 24 seconds. That's the kind of transformation that the industry's looking for out of health IT in medicine. What we saw, though, in that process was that over half the care provided for active duty retired service members comes out of the private sector. So if you're in military health or you're in the VA system and you go see your local doctor, they don't have access to that information.
Disconnected.
They start from scratch.
Separate silo.
If you come back to the VA after all this care in the private sector, they don't have any access. So we knew we had to get to the commercial side. Care Effects provides that connected framework in the commercial side. So Harris, if you talked to us a week ago, we were the leader in interoperability, providing that connected framework at the federal level. We were the leader in the federal level for imaging, taking our intelligence community imaging and applying it to health. As of this week, we go from the federal sector to 1,000 hospitals around the world. We're now connected from the federal level to the private sector. And the ability to take that connected framework and display and organize information for clinicians, the way they work and think. Independent, they're not logging into all the different applications anymore.
Right.
We maintain the context of the patient, one login, and we organize the information the way the clinician works in things, using Harris's connected framework to deliver that information.
And that's powerful to be able to use it according to their workflow and what they want to see. Should increase adoption. Should increase adoption. It should.
For everybody.
For everybody, absolutely.
For everybody.
You know, I think we have a special opportunity in Florida with Lake Nona. You're
Yes.
familiar with Lake Nona.
Yes.
And the VA hospital and that gap of service that you talked about. I hope that we're addressing that with the VA hospital in Lake Nona right now, so that when it comes up, this community won't have that gap.
It's connected.
This is connected. That sounds good.
Yes, that's what has to happen.
Yes.
So what the beauty of the Florida HIE is we're going to have a model that connects physicians to hospitals, to regional health information exchanges, to the agencies. And the software we're using is what we created at the federal level, so you're also connected to the federal agencies.
Right.
Physicians to the national level, all connected. That's going to fuel the transformation.
Man, that is utopia for me. Thank you, Jim. I really appreciate your time. And thank you for being here in Florida.
Thanks for being here.
All right. Thank you.